नहीं वो है मैडम वो वो
मैडम से कह देता हूँ आपको इंट्रोड्यूस कर दें।
You all for today's program, National Conference on Interdisciplinary Approach to Amraze Dimagh wa Asab, that is, diseases of central nervous system. To begin with this auspicious day, I would like to give a brief introduction for today's program. Interdisciplinary research has an important place in scientific field. The efforts of scientists in their own fields can create the tools to provide the basis for many future efforts. Interdisciplinary approach often built on a single disciplinary discovery. Up until a few decades ago, scientists engaged themselves in a many endeavors and identified themselves as anatomists, physiologists, psychologists, etc. The discipline of neuroscience arose by continuing efforts of scientists in different fields to solve a common scientific problem. It's a dynamic discipline in which new fields continue to be integrated. With this, we would like to start our first scientific session. As I want to inform you all, our chief guest is on the way. So, because of that, we're going to start our first scientific session. I would like to call upon Dr. Muzaffaruddin Ahmed Bhat. He will be giving a talk on concepts of pathogenesis and diagnosis of Amraze, Dimagh, Asap in Unani medicine. Dr. Muzaffaruddin Ahmed Bhat, presently working as an assistant professor, Department of Mullijat, National Institute of Unani Medicine, Bengaluru. He is graduated from AKTC AMU Aligarh and completed MD in Mullijat from AKTC AMU. He has an experience of 16 years in clinical teaching and research experience and has guided around 14 PG scholars. His areas of research include cardiovascular diseases, lifestyle disorders, and psychiatry. He has 79 publications and research articles in his credit and has published around one book and has a papers presentation of around 23. He has attended many conferences and workshops and has been invited as a speaker to international and many national conferences. Over to you, sir.
Thank you, Renuka ma'am. Respected in charge director, Professor Gulamuddin Sofi sir, faculty members, PG scholars, ladies and gentlemen. Assalamu alaikum and a very good morning to all of you. At the outset, I would like to thank organizers for giving me as all of us know that nervous system is the smallest in terms of weight, but it is the complex one in terms of its function. When we talk in terms of Unani system of medicine, it is a little more complex because our system along with scientific philosophical categories. So I will try to control my best. Ahead. Try to explore the capabilities of Amraze and we will try to understand the principles of diagnosis and to understand the determinants of treatment. We will also try to bridge the Unani perspective with the modern viewpoint. As I already told you that it is the smallest body system among all the 11 body systems, which creates around 3% of the total body weight, about 2 kg. And out of that 2 kg, brain weight about 1.3 kg. There are about 85 billion neurons and each neuron snaps to read 1,000 other neurons. So the number comes around more than stars in our galaxy. So you can understand how complex this system is in terms of anatomy. You already know that nervous system is controls and coordinates all other body systems so that it maintains the homeostasis of the body. And it is the control center for registering sensations, correlating them with one another. And it is the center of intellect, emotions, behavior. So it is little about nervous system, what we have hoped to connect with the medicine. My focus will be only on Unani perspective because we have modern expert also conventional system of medicine, which is very new. So, according to when we talk about Amraze sir, he means that with the brain and with membrane. So, when we talk about Amraze sir, these are the diseases of brain and its meninges of membrane. And we have about 36 diseases in our Unani literature which are related with the brain and mental disorder. So we will not discuss the mental disorder. So much time, so you can see it. I have Is it from my side? Or? Okay. Now, let's discuss the classification. You know, we have classification, ICT classification. Similarly, Unani scholars have also done the classification of every disease of any system. So similarly, in the nervous system, they have also classified the diseases on the basis of its etiology, on the basis of anatomy, whatever we talk. Even when we see in today's in one or the other way, in today's scenario also. First is the etiological classification done by Jali. He has given 5 types. He has given one raw or separate cell of the brain or its membrane. He has categorized some disease with that. Other cause could be Godavi Aklat or Rasmi Bukhara, morbid Balkani Aklat, Ritibati Fudli, and all types of headache which can occur because due to all these 4 causes. So he has categorized them into 5 types. Another etiological classification given by Sheikh Rais is on the basis of whether the disease is primarily in the brain or it is secondary to the brain, which we call as Amraze Asli or primary brain disorder or secondary brain disorder. Primary brain disorder is further divided into 7 types. Another classification given by Sheikh Rais is on the basis anatomical classification, whether the disease is in the brain or nerves. The diseases of brain are further classified into 4 categories. One, all the headaches have been put in the one category. Another is due to varam or tafarruq itsal, as Jalinus has done. Third one is impaired sensory and cognitive functions. And fourth one is deranged motor functions. And second is amraze asab, where we can see istirkha, falij, lakwa, tashannuj. So it is the anatomical classification given by Sheikhul Rais. Next one, very important, which we will discuss in detail, is determinants of brain health. What are the determinants of brain health? These are the determinants which state or which tell us about the illness or health of the brain. So these are 11 in number. It is afali hisiya, afali siyasiya, afali harkiya, afali tabiya, fundamental lifestyle practices, size of head, shape of head, heaviness or lightness in the head, conditions of organs contributing to brain development, strength and function of organs associated with the brain, and condition of organs influencing the brain. We will discuss them one by one. Before we will discuss, let's see what is Mu'tadil Dimagh. What are the characteristics of Mu'tadil Dimagh? It should fulfill 3 criteria. Then we can say that it is Mu'tadil. One is afali hisiya, afali harkiya, and afali siyasiya. They should be robust and optimal at its function. Number second is there should be balance between the excretion and retention of fuzlate dimagi. And third one is if the brain can manage diseases and other complications that threaten health or its functioning. If it fulfills all these 3 criteria, we can say that brain is in state of health, or we can say that it is Mu'tadil. Now, categories of brain function disorder. There are 3 levels of brain function disorder. One, it will be zof wa nuksan, that is there will be reduced or impaired functioning of the brain, or there will be tagayyur wa tashwish, that is there will be alteration or disruption in the cognitive, sensory or motor functions of the brain. And third one is the batlan or complete dysfunction, where there is total loss of brain function. So at the end you can ask me. So general pathogenesis of brain dysfunction. It is actually due to reduction in the function is due to increased viscosity of the ruh. When there is increased viscosity, it results in the blockage in the uruk or its pathway, so preventing ruh to reach the brain effectively. And the primary cause of this is the excess of barudat and rutubat. We can say it is a generalized pathogenesis. Now we'll discuss the disorders of determinants of brain, which I already told you are 11 in number. First one is impairment of sensory functions. We know that five sense organs are there. As far the hearing is concerned, there could be disturbance in the hearing. It is because of yabusat in the midbrain or the retention of ru in this region, or there will be complete deafness. That is also because of rutubat in the same area. There could be anosmia. That is because of excessive brudat or parosmia. When aklad get accumulated in the ventricles and get infected, that can result in parosmia. And the next one is disturbance in the vision, khayalat, or visual hallucinations. They can manifest in different ways depending on the dominance of a particular khil. For example, red in case of dam, yellow in case of safara, and black in case of soda. You can interpret it like that. And the fourth and fifth is taste and touch. They are also affected by the accumulation of specific aklat in the brain. Second is impairment of cognitive functions. Here, there could be impairment in Quwwat Khayal and Tasawwur. Similarly, there could be Zof or Batlan. I already told you there are three categories of dysfunction of the brain. There could be Zof or Batlan, where the person is unable to retain the information like face, words, structures. He is not able to retain that information. And the cause is dominance of Burudat along with Yabusata Rutubat in the forebrain. Area is very important. When we talk about the area of the brain, it also, we can say, when we talk in terms of conventional system of medicine, these areas is located in the, just say, as I told you, this area is in forebrain. Similarly, when we talk in conventional system of medicine, same area is being described in that system. Tagayyur wa tashwish, individuals may experience hallucinations. That is because of dominance of hararat. Second one is impairment in quwwat fikr wa khayal. There could be also nuks wa batlan, which we call as zahab aql or humak. The cause is burudat, yabusat or rutubat in the midbrain. Tagayyur wa tashwish could be there. It results in ikhtilat aql, and the cause could be worm or safara or soda in the midbrain. Third, impairment in quwwat zikr wa quwwat hafiza. There could be zof, tashwish or nuks, dominance of burudat, yabusat or rutubat in over the hindbrain. Here the area is hindbrain. Mostly I told you that primarily burudat is affecting the brain, but there could be rutubat or yabusat, which could be secondary to the burudat. Now the third one is impairment in afali harkiya, motor dysfunctions. It could be partial or complete. Taking the example of partial, it could be falaj, lakwa. When we talk about complete dysfunction, we can take example of sakta. Here the cause is accumulation of raqiq rutubat fuzliya in nerves, which can result in lakwa, falaj, and it can also be due to hararat and yubusat in the brain or nerves. Fourth one is impairment in brain's physiological functions. We can assess it with Dimagh fuzlat. We can see the nature, we can see the quality and the associated symptoms, which can help us in diagnosing which type of mada is accumulated in the brain. If there are excessive secretions, it tells us that there is excessive mawad in the brain, and quwwat dafiya of brain is strong enough to expel it out. If there is reduced secretions, it along with its associated symptoms like heaviness, tinnitus, vertigo, it indicates that there is excessive mawad, but brain's quwwat dafiya is not strong enough to excrete it out. So we can interpret which type of madda is there in excess by the symptoms associated with that particular health. For example, if there is excessive safra, there will be associated symptom like burning sensation, irritation, heaviness, or yellowish discoloration of brain, yellowish discoloration of eyes, face. If there is excess dam, there will be intense heaviness, zarban, redness of eyes. If there is balgam in excess quantity, there could be sluggishness, lethargy, or in case of soda, blackish discoloration or intense heaviness, or there will be disturbing thoughts. Next one is inferences from tadabir zaruriya. These are also diagnostic as well as therapeutic. Taking the example of air, diet, and fragrances. If it is sue mizaj har dimagi, the patient will get relief with cold, or we can say cold air, diet, or calming fragrances. If there is sue mizaj barid, the warm air, diet, or fragrances with heating effect can relieve the symptom. And response to istifrag is also diagnostic. In case of sue mizaj yabis, if excessive evacuation of dimagi fuzlat is being done, it will worsen the condition. However, if there is sue mizaj ratab, it will relieve the condition. So it becomes diagnostic also. 6 and 7 is inferences from size and shape of the head. In the conventional system of medicine, also it is written that shape and size of the head also help us in determining the state or condition of the brain functioning. As you have seen in various diseases, various syndromes, there is change in the shape and size of the head. Similarly, in Unani system of medicine, size and shape of the head has been given also importance. If the size of the head is small, with normal shape, it indicates that there is small defect in hayat dimag, and it is because of insufficient latif mada, which is required for the optimal development or growth of the brain. If the small head with altered shape, it indicates that there is significant defect in hayat dimagi, and cause is the same. Latif mada is in insufficient quantity, so that the brain is not developed to its optimum size. Large head with normal shape, if it is accompanied with thick neck and broad chest, we call it as jududat, judate dimag, that is superior brain quality. Head, large head with broad chest and thick neck, it shows that it's the superior brain quality. So you can see around agal bagal mein dekho. Large head with altered shape, it does not indicate the strong brain. However, it indicates that there is excessive mada in the brain which is not developed properly. Eighth one is heaviness or lightness in the head. How can we diagnose with it? Heaviness in the head, it is primarily because of accumulation of excess mada in the brain. So which type of mada is accumulated, we can we can inference with the associated symptoms. For example, in case of safra, there is less pronounced heaviness dominated by burning sensation. If sauda is there, there will be significant heaviness accompanied by excessive dryness. In case of dam, it will be more heaviness as compared to safra and sauda, associated with zarban or deep orbit pain. In case of balgam, there will be intense heaviness, more highest in compared to all these three, but pain will be mild, but accompanied with sleepiness, lethargy, and fatigue. Tactile sensations, they also help give us some diagnostic insights. For example, if the local temperature is increased, when we touch the scalp and we got the local temperature is increased, it indicates that there is excessive hararat. If it is decreased, it indicates that there is burudat. And if it is dry and rough scalp, it indicates there is yabusat, and excessive sweating indicates rutubat. Another is pain sensations. The nature of pain varies according to the type of mada. For example, in case of har and tez mada, sensation of the pain will be like some insect bites in head or nose. And if the cause is varme har, sensation will be similar to the blunt impact on the head. In case of sakil and barid mada, the pain will be constricting in nature. And if the mada is there, it will be migratory pain. Pain will migrate from one location to another location. 9.1 is abnormalities in nearby organs. The abnormalities in nearby organ, when there is any abnormality in the brain, it also affects the nearby organs, and one of the most affected organ is eye. It's written in Unani system of medicine, one of the most affected organ by the disorder of the brain is eye. Dryness in the eyes indicate yubusate dimag. Lacrimation suggests excessive rutubat in the frontal head. Difficulty in opening or closing eyes points to a severe brain disorder, and increased blinking If the person blinks frequently, it can indicate ishtale hararat or junoon. Fixed gaze, it is associated with waswas or melancholia, and sunken eyes indicates that johar dimag is brain matter is less or depleted. Second one is tongue. There could be slurred or hesitant speech in case of zofe dimag, and loss of taste or insensitivity reflects impaired brain function. So the nearby organs, others we can interpret also, these get affected by the disorders of the brain also. So condition of organs associated with the brain. The other organs which are associated with the brain, if they are in optimal health, brain will be also in the optimal health, and they negatively also affect the brain. If there is any disorder in those organs, that can also affect the brain. 11th and last one is condition of organs influencing the brain. Stomach is number one. It is written in Unani literature that stomach is having the greatest impact on the state of the functioning of the brain. If headache begins at the vertex and spreads to the interscapular area, we can diagnose that it is of origin is Sudai Shirki Mehdi जिसको हम कहते हैं. It originates from the stomach. And if headache is due to involvement of stomach and it increases during imtila or nafak, and if the pain worsens on an empty stomach or during hunger, it is because of hararat meda or mirra safra. So we completed these determinants. Let's move to our next segment, that is how can we correlate between Unani concepts and modern neurosciences. It is not an absolute correlation. It is not possible to correlate one system of medicine with another system of medicine absolutely. It is not absolute correlation. However, here I have tried to correlate some of the neurotransmitters. How can we place them in a particular health, particular humor, depending on the functioning of that neurotransmitter. So you can see here, we know that Dam has the, it is associated with vitality, optimism, and emotional stability. It can be correlated that serotonin belongs to this health because it also regulates mood and emotional well-being. We can put the serotonin in khilate dam. I don't mean that dam is serotonin. No, we can place these neurotransmitters. We can say that it belongs to this health. Similarly, balgam is linked to calmness and stability, and GABA, a neurotransmitter, it inhibits overexcitement and promotes relaxation. We can say that this neurotransmitter belongs to khilate balgam. Similarly, safra, it garners passion and energy and anger. Dopamine and norepinephrine are involved same in alertness, motivation, and stress responses. So we can say that this dopamine and norepinephrine, it belongs to khilate safra. Similarly, soda, as you all of know that, it's associated with introspection, melancholy, and overthinking. We can relate it to excess cortisol or reduced serotonin, which can lead to depression and anxiety. So we can place that cortisol belongs to khilate soda. Don't confuse. I'm not saying that soda is cortisol. Only that we can place it there. Neurotransmitters or hormones, we can place them in a particular health. So by example, we can understand it. Depression and neurochemical imbalances. Unani perspective, as all of you know, it is because of suemizaj soda. Excess soda leads to dryness in the brain and impairing its function and causing mood disturbances. It is our concept. Now, when we see what is there in modern neurosciences, it's linked to a neurochemical imbalances. Low serotonin, low level of dopamine and norepinephrine, and chronic stress increases cortisol, which damages the hippocampus and prefrontal cortex, leading to negative thought pattern. Here you can see, here it is increase in cortisol and decrease in serotonin and dopamine and norepinephrine. We say that if there is suemizaj soda in depression, it means that soda is in excess quantity, or its quality is not good, it is in excess quantity. When we compare it with dam and balgam, proportionally they will be less. When one health is excess, proportionally other will be in less quantity. So with this example, we can understand that how we can place these neurotransmitters or hormones into different humors. So it can be applied to other also. So now how can we, as it is interdisciplinary conference, how we can bridge the gap? It is important. So integrative research, we can explore how Unani interventions for balancing akhlaq impact neurotransmitters. We know that there is suemazide soda in case of depression. We give the treatment, we give we use our regimes, we use medicine, and then we correct the suemazide soda. Along with that, we can also see that what happened to the serotonin level, what happened to the GABA, what happened to other neurotransmitters. So in this way, we can bridge the gap. So what are the benefits of this integrative approach? For whom it is beneficial? It is beneficial for all, like it is beneficial for patients, because patients will get personalized therapies combining Unani and modern approaches, so that we can give comprehensive care to the patient. Patient will get the choice. Second, it is beneficial for practitioners also. Cross disciplinary knowledge enhances diagnostic precision and therapeutic effectiveness. And it is beneficial for science also. How? Bridging ancient wisdom with cutting edge research enriches our understanding of the mid brain connection and leads to innovative treatments. So it is beneficial for all the stakeholders. In conclusion, understanding in depth the etiology and classification of Amraze Dimagh is important for developing appropriate usul ilaj in Unani medicine. A comprehensive understanding of the diagnostic methods of Amraze Dimagh is essential for effective treatment. The Unani system of medicine emphasizes the importance of balance in Mizaj as the cornerstone for maintaining mental and neurological health. In today's world, exploring integrative approaches that merge traditional Unani wisdom with modern scientific advancements can enrich both systems, offering enhanced therapeutic outcomes. Now, what is the future scope? If we do research in integrative approach, how it will help? We should investigate the synergy between Unani principles and modern neurosciences. We should conduct clinical trials to validate the efficacy of Unani treatments in neurological and mental health disorders. Also, we should have cross-disciplinary collaborations. By bridging Unani medicine with modern disciplines like neurobiology, psychology, and pharmacology, developing innovative diagnostic and therapeutic models through joint efforts of traditional and modern healthcare practitioners. And these efforts can enhance holistic care and establish evidence based frameworks for integrative medicine. Take home message: the convergence of Unani medicine and modern neuroscience offers a unique opportunity to develop effective treatments for neurological and mental health disorders. By leveraging their shared principles and complementary strengths, integrative research can pave the way for better therapeutic outcomes. Thank you. Thank you very much.
Thank you, sir, for your enlightening speech. I now request our director in charge, Dr. Gulamuddin Sofi, to kindly come over the stage and present a memento and certificate to Dr. Muzaffaruddin Bhatt.
Thank you. Thank you for patient listening.
Thank you, sir. Audience, I kindly request all of you to kindly come and occupy the front seats. And any questions? Yeah, please. Muzaffar, sir, you have a question.
हाँ डॉक्टर रुखसार बोलो.
Mike.
Multiple Dimagh, I already told you, if it fulfills these three criteria, if you know, I already told you Afali Siyasya, Afali Harakiya, and all these three I told you, plus other condition is if these are in a optimal functioning. A person, if he, I will give a simple example. If a person knows about the time and space, if he knows where he is and when he is there, time and space is very important. If a person knows that, then I can say that he is oriented. He is having, his brain is functioning properly. Time and space is very important. Wherever you are, I am here, I must know that I am on the podium, and what is the timing around me, what are the scenario. If I am aware of it, it means that I am oriented. That is what actually, it's the basic simply. Okay, thank you.
Thank you, sir. Moving on, I kindly request the PG scholars to kindly occupy the front seat. PG scholars. Hak, hak, sir. Hak, sir. Yeah, cool. Dear friends, our guest is on the way. I think she is busy on her phone. In shortly few minutes, we're going to start the inauguration program. Thank you.
Assalamu alaikum and a very good morning. We'll shortly start the inauguration session. The guests will be arriving in 5 minutes. Thank you.
Moving on, we're going to start our inauguration function for today's auspicious day. With this, I would like to call upon the guests for today's program to kindly come over and occupy the chairs. I would like to call upon Dr. Asima Banu, Principal, Bangalore Medical College and Research Center, Bengaluru, to kindly occupy the chair as chief guest for today's program. I would like to call upon Dr. Gulamuddin Sofi, In charge Director, National Institute of Unani Medicine, Bengaluru, to kindly occupy the chair. I'd like to call upon Dr. Manjula S., Principal, Government Unani Medical College, Bengaluru, to kindly occupy the chair. I request Dr. Ashia Sultana, Professor and Organizing Chairperson, Department of Imul Kubalat wa Amraze Nizwan, to kindly occupy the chair. I would like to call upon Dr. Kausar Fatima, Organizing Chairperson, Assistant Professor, Department of Imul Kubalat wa Amraze Nizwan, to kindly occupy the chair. Moving on with today's program, I would like to call upon Dr. Mirs Uzair, PG Scholar, Department of IBT, to kindly recite the Holy Quran.
السلام عليكم ورحمة الله. أعوذ بالله من الشيطان الرجيم. بسم الله الرحمن الرحيم. والضحى والليل إذا سجى ما ودعك ربك وما قلى وللآخرة خير لك من ولسوف يعطيك ربك فترضى ألم يجدك يتيما فآوى ووجدك ضالا فهدى ووجدك عائلا فأغنى فأما اليتيم فلا تقهر وأما السائل فلا تنهر وأما بنعمة ربك فحدث. I seek refuge in Almighty Allah from the accursed shaitan. In the name of Allah, the most merciful. By the morning brightness and by the night when it covers with darkness. Your Lord has not taken leave of you, O Muhammad sallallahu alaihi wasallam, nor has he detested you. And the hereafter is better for you than the first life. And your Lord is going to give you, and you will be satisfied. Did he not find you an orphan and give you refuge? And he found you lost and guided you. And he found you poor and made you self-sufficient. So as for the orphan, do not repel him, but as for the favor of your Lord, report it. Assalamu alaikum.
Thank you, Dr. Hussain. Now we move on for the floral welcome for dignitaries. I call upon Dr. Gulamuddin Sofi, in charge director, NIUM, to kindly hand over floral pot to Dr. Asima Banu as a token of welcome. I call upon Dr. Arshi welcome Dr. Manjula, Principal GUMC. I request Dr. Arshia Sultana to kindly welcome Dr. Gulamuddin Sofi, in charge director, NIUM. Moving on with today's program, I request Dr. Ashia Sultana to kindly address.
Assalamu alaikum. In the name of Allah, the most beneficent and the most merciful. Good morning to one and all here present. Increased guests. It is with great pleasure and honor that I extend a warm welcome to you all at the National Conference on Interdisciplinary Approach to Amraze Dimagh wa Asab, Disease of Central Nervous System, organized by National Institute of Unani Medicine, Ministry of Ayush, Government of India. Today it is a remarkable day as we have gathered here in this interdisciplinary perspectives of the disease of central nervous system, a topic of immense significance in contemporary healthcare. At the outset, I take the opportunity to extend our heartful welcome to our chief guest, Dr. Asima Banu, the principal of Bangalore Medical College and Research Institute. She is not only a pioneering microbiologist and virologist, but also a celebrated academic leader. She has dedicated over 2 decades of her life to this esteemed institute. Her commendable contributions include serving as head of the microbiology department at boarding hospital and as the nodal officer for COVID-19 ward at Victoria Hospital during the pandemic. She is a COVID warrior. She's selfless service and dedication earned her the title of COVID warrior, a testimony to her commitment to public health and education. It's a privilege. Is evidence of importance of bridging traditional and modern medicine to improve healthcare outcomes. We are very It is my great pleasure and honor that I extend a heartfelt welcome to Dr. Manjula S., Principal of Government Unani Medical College and Hospital, Bangalore, to this esteemed gathering. Your presence today immense value to the national conference. We are deeply grateful for your unwavering support and look forward to your insights during the course of this event. Thank you for joining us, and we warmly welcome you to this enriching platform. We warmly welcome Professor Gulamuddin Sufi sir, Director to travel from various parts of the country to contribute the insights to this event. As we embark on this day, rich discussion and exchanges, let us collectively strive to pave a path that integrates Unani medicine with Ayurveda, Siddha, Homeopathy, and modern medicines, fostering a holistic approach to treating central nervous system disorders. Together, we pave the way for innovative, inclusive, and patient-centric solution to improve health and well-being. With this, I wish you all, and I welcome all of you. Thank you.
On behalf of the audience, I thank Dr. Arshia Sultana for her speech. Now I call upon our chief guest, Dr. Asima Banu, to kindly address the audience.
A very good morning. Assalamu alaikum warahmatullahi wabarakatuh. I think this is the second time I am visiting your institute, and whenever I come here, seeing the campus itself makes me very happy. It's away from the city, but within the city, and it is pretty healthy environment with lot of greeneries. So you are blessed to be in this campus. Today is the CME, and when Arshia called me for this, I agreed very happily to be here for some time. But then now, because of some government emergency, I'll not be staying for long and I'll be leaving immediately. So you will have to bear with me. One thing I want to tell you is knowledge is power. So all this continued medical education programs and all that, it should not be forceful. It should be voluntary. Because when you come and sit in this forums or in these workshops, you get a knowledge in a small packet. If we have to collect that knowledge on our own, it will take days and hours, and we don't have the patience to sit and read that much. But when an expert is coming and delivering a talk, they would have done so much of research, so much of hard work would have gone into present that topic, and they will have collected information, and it will be recent information and what will be happening in future also. So I always believe CMEs should be attended not for the sake of that credit points or not for the forcefulness of your department or the guides, but I think it should be voluntarily for you to enrich your knowledge. I've always said that to my students and my colleagues also. So continued medical education in any field, in any discipline, is a necessary need of the day, because you never know where an pandemic will crop up, where a toxicity outbreak will come, where a food poisoning outbreak will come, and you will have to face it. And now you are in an institute, but when you go out from here, you will all be working alone. So when you are working alone, you should have some knowledge of what is happening. And the second reason why you should attend such program is you will have a development of your personal relationships with other people from other institutions. We in medical fraternity, as healthcare providers, cannot work alone, cannot function alone. We have to work together. And it is the easiest way to connect with other people is to attend such conferences, CMEs, and workshops. So the relationships or the contacts you get from these forums, you can use that anytime and it will come handy anywhere in future. So always remember that. Because any other profession, maybe they can function alone, but we always have to work as a team. All of us agree with that, isn't it? So having said that, congratulations to the department and the organizing secretary, the director, and all of you have put in so much efforts to organize this function, function and then the workshop. And I'm sure it will be very worthwhile. That I'm not supposed to do, but yes, CNS infections is always a challenge for us. Encephalitis, meningitis, and all that is one forte where CNS is concerned with us, or abscesses, and we do struggle with the diagnosis definitely. So I think today the whole day fruitful program. And since I work in the emergency, I also see a lot of strokes coming in, lot of TIAs, and lot of sudden loss of consciousness. So many issues related to the brain. So you will have a fruitful day. All the best to the whole team and all the best to all of you. And congratulations on arranging this function. You have to excuse me. It's really an emergency. I have to leave. Thank you so much. Jazakallah khair.
Thank you, madam, for your kind words. I now call upon Dr. Manjula, Principal GUMC, to kindly address the gathering. Okay. Yeah, I apologize for the changes. I request Dr. Gulamuddin Sofi, in charge director, to kindly give away the memento to Dr. Asima Banu, as she has less time. So we will finish up this function. Thank you, sir. Moving on, I would request Dr. Manjula S., Principal GUMC, to kindly address the gathering. Good morning, everyone. Respected in charge director, Dr. Sophie sir, and Department of Ilmul Amraze on Isfana Kabbalah, Dr. Asha madam, and organizing secretary, Dr. Kausar. And good morning, everyone. So today we are looking at the two best great tradition, that is modern medicine and Unani medicine. Both have a unique ways of understanding and treating the diseases. So like the treating of the central nervous system as like conditions like Parkinson's, then Alzheimer's disease, then multiple sclerosis and anxiety has become more common. Combining these approaches is more important than ever. See, like modern medicine gives us an advanced like technologies, like you can go for CT scan, treat with the medicines and surgeries, whereas it helps in very quick diagnosis and offering hope for the patient with complex problems. Like whereas in Unani medicine, on the other hand, comes from the ancient wisdom, so it focuses on healing the whole person, keeping the body and mind in balance and using natural remedies. For example, it uses like herbs like we know that Raulfia serpentina to calm down the nervous system to, and also to improve the brain memory and also the other brain functions. So by bringing these two combinations, that is the modern medicine and Unani medicine, so together we are dealing with the interdisciplinary approach to the Amraze, Dimagh, Asab, that is the central nervous system. So we look forward for the treatment and symptoms and root causes of the disease. Collaboration opens new opportunities for research, better care, and also deeper understanding central nervous system diseases. So let us join hands together for the modern and as well as the Unani medicine. So I'm very lucky to be on this stage, the part of alumni of this NIM. I keep on repeating this from since many times have been called for the guest. So looking forward for these kind of collaboration of NIM with GMC is a great privilege or honor for me to present here. Thank you, one and all. Thank you, madam, for your kind words. Now I would request Dr. Gulamuddin Sofi, in charge director, NIM, to kindly give his thought about today's programs to the audience.
Assalamu alaikum and good morning to all. Respected Dr. Manjula, Principal GMC, and Dr. Kausar Fatima, with all the honors for Dr. Asima Banu and Arshia Sultana, who are on the dais, and my colleagues of the dais, all the participants and PG scholars who have joined us today. Basically, I would like to put this conference in perspective. It is a prelude to our Unani Day 2025. We started all the activities for 2025 Unani Day with this national conference. And it is an auspicious moment that we are doing an academic activity for upcoming 2025 Unani Day. I am very much thankful to the guests who have come up here, who are on the dais and off the dais, who are joining this conference. The theme of this conference basically is integrative approach to neural diseases. Basically, we have not only modern medicine and Unani, we have our reputed speaker, Mudassir Mullah sir here, who will be giving us the perspective from homeopathic medicine also. So these themes, because of these themes, we will be able to see how much the scope of integration is there between various systems of medicine for diagnosis and management of disease of brain and nervous system. As we had our inaugural, after one lecture, we saw that the ball has been set rolled in a very strong footing. We saw what Unani says about the diagnosis and etiology of these diseases, the disease of the nervous system, and then we see the determinants of health. And I congratulate Muzaffaruddin that he has put forward a lot of efforts to bring out the Amraze, Dimagh, Asab in a very good perspective. Lastly, I would just hope and wish that this conference brings you all that what is needed to understand the disease of nervous system and brain. But there is a dichotomy, not only in studying various systems, but there is a dichotomy in understanding the diseases of brain also. We have the psychiatric diseases and the and the neural diseases. Both are at different planes, and we should be thankful to our Unani scholars who have given us a comprehensive approach about brain and mind. Ibn Sina has given us 4 types of okul, or 4 types: the vegetative brain, the reflective brain, then the intellect, and has deduced a lot many inferences about how to manage various psychiatric diseases and various organic diseases of nervous system. And I hope in this perspective our this national conference will go forward, and my best of the wishes are with you. We have tried to give you the conducive environment, give you the facilities, and now it is up to you how much you will extract the